Depression is a complex medical illness, and it can also coexist with other mental disorders. So symptoms may be different from one person to the other. This video will discuss the levels of depression and the various types of depression. Without further ado, let's get started. 3 levels of depression. Depression, in the medical sense, is the feeling of hopelessness that won't go away. It may also have other symptoms that affect your life. Depression can be classified as mild, moderate, and severe depression according to the type of symptoms, their severity, and how often they occur. What is mild depression? Once in a while, it is normal to feel depressed. But if your symptoms last more than a few days and to the degree that affects your daily life activities, you might have mild depression. Typical symptoms of mild depression are irritability or anger, hopelessness, feelings of guilt and despair, self-loathing, sleep pattern change, appetite changes, weight changes, a loss of interest in activities you once enjoyed, difficulties concentrating at work, a lack of motivation, a sudden disinterest in socializing, unexplained, minor aches and pains, daytime sleepiness and fatigue, reckless behavior, such as abuse of alcohol and drugs or gambling. Though they are noticeable, many people with mild depression can manage these distressing symptoms. But over time, they can take a toll on the person experiencing them. In addition, mild symptoms can be warning signs of more severe depression, so a person who experiences new or worsening symptoms should seek medical help. However, mild depression is the easiest to treat. Sometimes, lifestyle changes are enough to eliminate depressive symptoms. Daily exercise, regular sleep time, a balanced diet rich in fruits and vegetables, relaxation and meditation. Recreational activities offer distraction and social interaction, reducing the use of alcohol and tobacco. Supportive social contact. Please discuss treatment options with your healthcare provider. What is moderate depression? If mild depression worsens, it will become moderate depression. In addition to the common symptoms shared with mild depression, moderate depression may also include low self-esteem, increased sensitivities, excessive worrying, reduced productivity, feelings of worthlessness. Symptoms of moderate depression are more intense. You may struggle at work and in daily life. You may also find it difficult to maintain social relationships. Your doctor may prescribe antidepressants, such as SSRIs. For example, sertraline or Zoloft or paroxetine or Paxil. Sometimes, cognitive behavioral therapy or CBT is helpful. Talk to your doctor for an accurate diagnosis and appropriate treatment plan. What is severe or major depression? Severe or major depression also shares mild to moderate depression symptoms. However, the symptoms are much more intense. People close to you might start to notice them. Major depression may also have these symptoms: delusions, feelings of stupor, hallucinations, suicidal thoughts or behaviors. On average, episodes of major depression last 6 months or longer and may reoccur. You should seek medical treatment immediately. If you have suicidal thoughts or behaviors, contact your local emergency service or crisis hotline right away. How many types of depression are there? Here is a summary of different types of depression. 1. Major depressive disorder. Major depressive disorder or MDD is the more severe form of depression. The distinctive feature is the persistent feelings of sadness, hopelessness, and worthlessness. 2. Persistent depressive disorder. Persistent depressive disorder or PDD is also called dysthymia. It's a milder form of depression, but the symptoms last for more than 2 years. It may have a more significant impact on your life due to the long period. 3. Depression in pregnancy. It is estimated that depression can happen to 3 to 6% of new mothers during pregnancy. It is a serious health concern. Due to safety issues of antidepressants, treatment for depression during pregnancy may be mainly by talk therapy and other natural therapies. 4. Postpartum depression. Baby blues is a common feeling of sadness or emptiness among new mothers. In most cases, it will disappear in a few days. However, about 1 in 9 new parents, including fathers, may have symptoms of depression for longer than 2 weeks after childbirth. This condition is called postpartum depression. Dramatic hormonal changes after pregnancy likely cause this condition. 5. Bipolar depression. Bipolar disorder is also called manic depression. It is a mental health condition that causes extreme mood swings between mania and depression. During the mania stage, you experience emotional highs. You may be full of energy and feel euphoric. During the depression stage, you feel sad or hopeless, and you lose interest in most activities. These mood swings can affect every aspect of your life. Medications and psychotherapy are the primary treatment plan. 6. Depression and anxiety. Over 70% of people with depression also have symptoms of anxiety. These two mental disorders have some common symptoms: irritability, difficulty with memory or concentration, sleep problems. Both anxiety and depression can be treated with psychotherapy, medications, alternative therapies such as hypnosis and meditation. 7. Depression and obsessive-compulsive disorder or OCD. Obsessive-compulsive disorder or OCD is a type of anxiety disorder. Typical symptoms are: obsession is unwanted and repeated thoughts, urges, and fears. Compulsion is repeated behaviors to ease the stress caused by the obsession. Loops of obsessions and compulsions. Up to 80% of people with OCD also have major depression. 8. Depression with psychosis. Depressive psychosis is a mental disorder in which patients have symptoms of major depression and psychosis. Individuals may see, hear, believe, or smell things that aren't real. At the same time, they may also feel sad, hopeless, and irritable. People with this condition are particularly prone to suicidal thoughts and reckless behavior. Treatments include medications and electroconvulsive therapy or ECT. 9. Depression and alcohol. People who have depression are more likely to misuse alcohol. According to studies, up to 50% of people who abuse alcohol or drugs have a mental illness. Depressed people may try to relieve the symptoms by drinking alcohol, making the matter worse. A quick reminder: this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you like the video, give it a thumbs up and share it with your friends. Comment below to share your thoughts about different types of depression. Please subscribe to our channel. Your support means everything to me.